planning system should be organized in order to guarantee a constant process. The organization of the planning system inevitably reflects the institutional assets of the country and is strongly affected by the current regulation on the subject that often defines the centralism-decentralism of the process, the involved actors, and the approach to be followed, top-down or bottom-up. Also, the involvement of the stakeholders, when it considers useful to the decision-making process, is different depending on the institutional context and the role assigned by the law or by the national regulation to the different stakeholders. One of the main recommendations on the health workforce planning subject concerns the availability, quality, and exhaustivity of data. We need to know first where we are before we can know where we are heading. So the first step of any good health workforce projection is good data about the current situation. We can say that one of the key requirements for human resource planning in the health sector are accurate and comprehensive information system on the actual number of healthcare. In many cases, it's difficult that data utilized in the forecasting model are collected with the main purpose of health workforce planning. Often our information derived from a multiplicity of data sources whose aims are varied and in any case different from the planning. The required level of detail is closely connected with the forecasting model developed and with the variables it considers and may cause the contemporaneous use of information collected at the local, national and even international level. The definition of a forecasting model and its implementation are core activities inside the planning process. The forecasting model and its results, projections and scenarios construction allowed the instauration of a political debate with the stakeholders' involvement, represent an essential instrument to support decisions and the action of the policymakers. Defining the model of the forecasting to be used is an important task to achieve. The different aspects to be considered are variables on supply and demand side, the algorithm to join them, the method to be used for the definition of the estimations, the assumption to start from, the modalities for the presentation of the results, one or more scenarios, etc. It is essential to clearly outline the assumptions behind the planning tools, maintain a flexible approach, and adapt the planning strategy as needed. To reach the goals of the planning system and so turn what has been planned into outputs, it is important to use the right levers and put into practice the right actions. From an organizational point of view, it is also important to define the responsibilities related to these levers and actions. Finally, it is crucial monitoring and checking that those actions and levers provide the desired results and that the objectives has been achieved. The objective of the planning system is really the final meaning of the whole planning system. In the literature is citing, for example, balance between need and supply for a profession. It is also possible that the objectives include restraints, it has budgetary limitations, which mean that the system also has to find an economical balance. It seems that the process of definition of the objectives is one of the main means to interest stakeholders like policymakers. It is very important to state if the objectives also include indicators and how they are defined. For your attention.